we transfer an embryo that's euploid, that's as far as we can take it, and we can use the carrier screening to make sure that we're not going to transfer a gene mutation that's known. But besides that, there is nothing more that we can do at this point to technologically advance that look and that analysis for a healthy offspring. Okay, everybody, I want to talk to you about what we know and what we don't know when we have a euploid embryo. And so I imagine most of you that are watching this are interested in IVF. And in 2022, if you're interested in IVF, you know about something called PGT-A, preimplantation genetic testing for aneuploidy. And aneuploidies are the medical term for an embryo that has a disorder with its chromosomes. Chromosomes being very large pieces of DNA, and they're usually arranged in pairs, and there's 23 pairs in human cells. And so we're typically looking for a result of 46 chromosomes that are evenly balanced throughout 23 pairs of chromosomes. And so when we have that information, what does that tell us and what does that not tell us? And basically what it's telling us is that there's no evidence that we have a large defect, genetically speaking, in the embryo. So a large defect would be missing a whole chromosome, for example, or adding a whole chromosome. So again, very large piece of DNA. Sometimes it's helpful to understand the genetics through an analogy to a book, where a chapter would be missing from a book. That would be like a chromosome being missing from the embryo. And so that tells us a very important piece of information. The most probably well-known defect would be an additional chromosome. So it's like an extra chapter in your book that's not needed. And specifically, if that takes place on the 21st chromosome, then that's something also known as Down syndrome, which a lot of patients and people have heard of. So that's a big deal. That leads to very certain consequences with the outcome of the pregnancy and potentially the live birth in the child. Now, we're able to verify that. In 2022, we have the technology to do that. It's not 100%, but it's really very good. And what we don't have the technology to figure out, though, at this point is something that would happen at the subchromosomal level. So in other words, to go back to our book analogy, that would be a paragraph or a sentence missing, especially if it results from a spontaneous event during the embryo's early life and creation of cells and growth. And we cannot detect that because it's spontaneous. If we don't know about it, we can't detect it. But there are certain ones that we do look for, certain genes we're talking about now, and those are normally something that's inherited through a kind of subtle way, what we call recessive pattern. So in other words, you don't have any signs or symptoms that there's anything wrong, but you carry a gene that would be categorized as a mutation. And the reason is because it could lead to a disease in a baby. So we can look for that, but we have to look for it up front, and we have to know what we're looking for. It's not just like across the board looking at every single, again, going back to our book analogy, we're not looking at every single word in the book. We can't know technology for that. So that's called carrier screening, the test you do up front. Usually it's done through blood or saliva from the egg source and the sperm source. And then if we know you have it, then we can look for that in embryos. So to recap, we have chromosome status, having whole chromosomes in pairs, 23 of them, we can look for that. If we looked preemptively to look for a gene, specific gene, not every gene, then we can look for that. And then finally, we have a big bucket of everything else we can't look for. And that's everything I mentioned previously, which is anything that would be de novo, means it arrived after, so we have no idea that it existed before or didn't exist before. We also have in this category what we would call multifactorial disease. So that means that when a child is born with, for instance, a heart defect or maybe a spina bifida, something like that, there may be several contributory factors that played into that happening. Part of it being genetics, but we don't understand, we don't know the gene, things like this, but there probably is a genetic component, so we cannot look for that. So when we transfer an embryo that's euploid, that's as far as we can take it, and we can use the carrier screening to make sure that we're not going to transfer a gene mutation that's known. But besides that, there is nothing more that we can do at this point to technologically advance that look and that analysis for a healthy offspring. Now, I'm sure that's going to be here shortly. We're looking at becoming more and more efficient at looking at the entire genome very quickly. So that's looking through every single, again, going back to our analogy, every single word in the book very quickly, but that's not here yet.